Hi, everybody. This is Angelica Lemke from the School of Intuitive Homeopathy. Eugenie invited us to give a sample of one of our lectures that you can expect at our school. And this following lecture is on Bacterial Nosodes Part 2. Part 1 is on strep and all of our strep nosodes, and Part 2 is on additional bacterial nosodes. Many of them are unique nosodes that you can't find written up anywhere else, that we know about just through the sheer experience of working with complex kids. Our school is based in my house in Ashland, Oregon, but really it's global. We teach people in Australia, the United States, and Europe. If you'd like to find out more, please visit our website at www.intuitivehomeopathy.org. We also have an intuitive homeopathy podcast on Spotify, and you can also find us on Instagram. And especially if you are really interested on in-depth study of miasms, nosodes, and isopathy as well, and the application of those remedies for complex cases. We will be teaching an in-depth course on this starting this coming February 2025, and it will be also co-taught by Sarah Valentini, who is based in Melbourne, and myself. So you can find more about that on our website, and that will last February, March, April, and May, about 4 months. So again, enjoy this lecture, and if it resonates with you, please get in touch with us. Hi, everybody. I am going to share with you a second week on bacteria remedies because there are a lot of bacteria remedies. And last week we just talked about all the varieties of strep nosodes. So we're going to complete the bacteria this week and look at a lot of bacterial remedies. The miasmatic remedies that we looked at include bacteria as well. But a lot of the remedies that I'm going to share with you now don't have great representation in homeopathic materia medica, but they were really useful for me in these complex immunocompromised cases. And so some of them presented with labs that showed that bacteria, and then I got to see what the clinical picture looked like. And some of them I just kind of muscle tested bacteria remedies from my little chart of bacterial remedies, which is also in the Book of Life. So let's just look at the slides. All right, angry bacteria again, plus bowel nosodes. So this slide was in our last lecture. I just wanted to review it one more time. And these are the themes that I've put together. This isn't necessarily written elsewhere. It's just based more on my own feeling, just looking at them as a group as a whole, and my own kind of intuition and working with other intuitives feeling into it, that the themes of bacteria overall is this young, adventurous, aggressive energy. It's the energy of sexual growth. It's even the energy of puberty. This can be how teenagers are when they have their pus-filled bacterial zits and are looking to develop their boundaries with their parents and develop their sexuality. And so it's this kind of young, rapid growth energy associated with redness. I also see it associated with meat. When we eat meat, we become more young. Meat is given tons of antibiotics because of how easily they get bacterial infections. I also think of war and battlefields. I mean, when people were young and going out into battle, they would often die from those gangrenous wounds, those septic bacterial wounds. I mean, it's no wonder that the Narayani remedy of bacterial combination is called war. Okay, so there's this kind of angry, inflamed, pussy, boily when I say boils, like those big zits that have the white fluid in them, picture to bacteria. There's this sense that, in a healthy environment, the bacteria protect our boundaries. They are there at our mucosal linings, our skin, and they help ward off infection. And so it is about boundaries, and it's about the breaking of boundaries as well. And so unhealthy bacteria is about the disregard for the host. I'm going to break the boundaries, in this really kind of primal, warlike way. And so when we go along with this bacterial life cycle, the bacteria has this high exponential phase of growth. This goes along with the rapid infection that can take place. When we get a bacterial infection, it can just really move through the body quickly. It can kill somebody quickly. And then it uses up all the resources that it feeds off of. And then there's the death phase, and the death phase correlates with the body's own feeling of, okay, I need to pull back in. And so there's this emotive phase of feeling negative, feeling bad, inhibiting. I need to inhibit this yang energy. I need to inhibit my aggressiveness. I need to push it back down. I feel bad about it. And so then it turns into kind of an autoimmunity because you feel bad about your aggressive behaviors. Aggressive behaviors are not accepted societally anymore. At one point, maybe it was, in the Middle Ages. And so there's a self-harm then that takes place. This is called the death phase. This is when people are cutting themselves. This is when people are really banging their heads against the wall. That's a keynote of tuberculinum is head banging. That's part of that death phase of the bacteria, just kind of hating itself. And then the dormancy, out of resources, kind of is at the bottom here. So that spike and that fall is part of, kind of almost like a bipolar type of personality that you can see in these extreme personalities of Meterinum and tuberculinum and young people where, they kind of like go all out. Maybe they go out with their buddies, they go drinking, they get aggressive, they come home, they beat their partner, and then they feel really bad about it, and then they maybe do something bad to themselves, and then the cycle repeats and they drink again, and then, it's just a really unhealthy bacterial imbalance. Just looking at the miasms and the bacterias, so Meterinum, Syphilinum, Tuberculinum are included here. These all have that young, aggressive, boundary breaking quality. We know this with Meterinum. And when these bacteria are out of balance and help define who we are these bacteria. These bacteria replicate by being sexually active, by spreading themselves through sexual activity, through touch, through yang force. So Meterinum is actually a diplococcus, meaning two little balls shaped bacteria that only colonizes humans. Neisseria gonorrhea, same as gonorrhea, but Meterinum only colonizes humans. It's never present in normal flora. And so it's pathogenic. Syphilinum, also Lyme, are both spirochetes. They're these flexible, twisted bacteria. People have seen these spirals in their sensation process with me, and so when they see that, I think, okay, spirochete, gotta give Syphilinum or Lyme. Tuberculinum is a mycobacterium. And I talked about how tuberculinum is a kind of remedy very useful for mold and mold sensitivity, and tubercular people are very susceptible to mold and fungal infections. Way worse nowadays that we have 5G, which potentiates it. So why is it called Mycobacterium? It's because these are bacteria that look like fungus. When they grow in a culture, a laboratory, they grow in a mold-like fashion. These are all pictures. This is a picture of tuberculinum. This is a spirochete, and this is gonorrhea here. So let's go into the rest of the bacterial kingdom. Many staph species exist much like strep. There are many non-pathogenic staph species which protect us. They look like this picture, little clusters of grapes. They can cause all types of infections, from food poisoning, bacterial conjunctivitis, skin diseases, meningitis, wound or surgical site infections, impetigo, cellulitis, and toxic shock syndrome. MRSA is antibiotic resistant staph aureus. You know, MRSA is what you can pick up in the hospital. Why? Because in the hospital, they use so many antibacterial cleaning products that it creates bacteria that then becomes antibiotic resistant. We cannot wipe clean the whole world of all of these bacteria. We cannot fight against them. What's happening in the hospital system is an example of that. What's happening with antibiotic resistant bacteria is a result of that. We need to learn about what is a healthy terrain, and a healthy terrain comes from not killing, but allowing all of these pathogens and microorganisms to live together in balance. And that's what homeopathy and natural medicine can do. You know, in my little meditation, I said there are times where we are going to need antibiotics, and these are extreme times, you know, so we want to kind of save those, you know. In naturopathic medicine and in homeopathy, there is a law called use the least force necessary to heal the person. In mainstream medicine, it's never used least force. It's always kind of like, you know, with pharmaceuticals, it's always a bit of an axe. It's always a bit stronger. We get to modify the amount of force we use when we use homeopathy and natural medicine. We can go gentle. And when we go gentle, we allow the body to rebalance itself. When we throw antibiotics and antifungals, it's like war itself. And it's like we've turned the war that was external in the world internal to inside of ourselves. So we don't want that war. We want peace. The mental and emotional state of Staphylococcinum presents very similar to strep. There's an overall negative self-attacking energy, which also can trigger tics and twitches. Ariana Zapp, who's a German healer, said with strep, not staph, with strep, I find chronic inflammation in the throat, tonsils, ears, and lungs, whereas staph, she finds definitely issues in the frontal nasal sinuses. So staph seems to really be in the nose. I've seen strep in there too, but she sees a lot of staph aureus there. I have treated a MRSA infection around the nostrils. Interestingly, with that MRSA infection around the nostrils, I didn't have MRSA at the time. I just had them take a swab of the crust, put it in a little water, swish it around, and then make a homeopathic remedy, and that cured it. So you can do those types of things with these little pussy discharges. You can make your own remedies. Okay, so the difference between staph and strep, you can see it here on the little microscopic picture. Staph isn't all lined up like strep. And in the same way, staph doesn't have the same lining up perfectionistic OCD that strep does. Staph is not as fastidious, it's messier. For me, I see staph really overlap with hormonal acne and the remedy Staphysagria. Staphysagria and staph have the same prefix. And I really feel like I don't need to use Staph aureus as often as I do strep, because Staphysagria helps balance out the energy that allows staph to persist. And that energy is suppressed rage due to boundary breaking. This Staphysagria is one of the top remedies for rape, molestation, sexual abuse, abuse of any kind, abuse of you stepping over my boundaries. And so Staph aureus is very similar. And so if you've used, Staphysagria and maybe you want to go deeper, try Staph aureus. So with staph infections, there's fever, chills, abscesses, bad rashes, boils, styes, cystic acne, acne on the thighs, the butt, kind of around that root chakra, that sexual area. There's a remedy, Kali bromatum, which is great for acne before your period. And it really is associated with that feeling of shame with sexuality, like guilt, feeling bad about oneself. And it's so built into our culture because of millennia of shame around sexuality. And so kids, when they are becoming more sexualized, they often get acne associated with the shame. And what does the acne do? Make them feel even more shameful, more embarrassed. Here's some quotes from some Staphysagria cases. Oh, I said Staphysagria, Staphylococcinum cases. To me, it is hard to separate the Staphysagria mental from Staph aureus. Anger, frustration, shame, embarrassment, indignation, judgment, suppression, history of abuse, often linked to sexual themes. Okay. After taking Staph aureus, I feel heaps of old indignation come up over the role of women in society. Oppression versus mandates and lockdowns, indignation over being controlled, told what to do. Since clearing Staphylococcinum, my girls have been letting go of old indignations in their relationship toward each other. They talk about it more. Let's see, I had one family after dosing Staph aureus, it appears sudden rage has settled down. This is a case of a mom and 3 boys all had a staph flare. The mom's mother, the grandmother, had her leg amputated due to MRSA. Now she has a staph infection in her other foot, and it is soon that her other leg will be amputated. She's in a nursing home. Her mother, so the great-great-grandmother, was a child born from rape. Then that grandmother before them was also a child born from rape who was given away. So a lot of history of rape, abuse. And so now the grandchildren all have chronic staph infections that are hard to clear up. Long history of sexual abuse and suppression showing up in grandchildren. Here's another case that I had. This was a woman who was she ran the Office of Sexual Assault Prevention. She was focused on issues of oppression, committed to social change, a lot of sexual abuse in her history. So in this case, staph came up and MRSA came up. But it was also the indignation at sexual abuse was there in the story. Okay, so here's a case where we cleared strep, staph, and another bacterial called Klebsiella, which I haven't talked about yet, but just wanted to give this as an example. So this was the child of a police officer, and the police officer himself was kind of an aggressive, ferrum kind of man. The mom was also pretty hyped up, Ignatia E. She said, I always had the sense that he was a fragile child. We did constitutional thuya. Thuya can be like really strong and aggressive on the outside because they are fragile and don't know who they are on the inside. The child had an ongoing staph infection of the skin. It was impetigo. He also had recurrent Clostridia, Klebsiella, and Enterobacter infections that they had tried to control with all types of pharmaceuticals. He had Chiari malformation, which is a bulging of the brain through the brainstem. So the sensation of this child was violent and anxious. When he sets his mind on something, he will not let it go and he will beat you. He will say, I have to have it. His fear turns into rage and he will beat on me. He'll throw books and furniture. He'll tear up his entire room. Sometimes he'll just get aggressive, hitting and screaming no. We have to do something silly to try and distract him. The hitting decreased since giving Klebsiella, Nosode Klebsiella, also a type of bacteria. So we did 2 years of clearing staph, strep, Klebsiella, constitutional thuya, and carcinosin. Doing great, empowered, stable, no longer apraxic. Actually, this mom became a homeopath and is very successful in the work that she does. Okay, so let's look at Clostridia. Clostridia also is not well known in homeopathy, but needs to be because it is really ramping up in prevalence. It's ramping up in prevalence because it colonizes the inside of the intestines after lots of antibiotics, and it causes really horrible diarrhea post antibiotics. That's disgusting. 500,000 people in the US get sick from C. diff, and they're really hard to treat. Clostridia gets flagged on lab tests as well. Yeah, and so this is the bacteria that kind of takes over when we kill and have an unhealthy flora. Clostridia has significant anger and aggression, is very self-injurious. This is one of the most aggressive bacteria. Actually, Klebsiella, which I'm not sure if I have any other slides on, is also very aggressive to bacteria. Klebsiella I didn't see as in as many kids, but Clostridia I've seen in lots of kids. And sometimes parents don't fully know that it's Clostridia, but when there's like strong aggressiveness, self-attack, and really stinky poops and diarrhea, as well as history of antibiotic use, definitely think of Clostridia. These kids, I've often seen they want to wear hooded sweatshirts. They want to like cover their heads, wrap up their heads, cover their ears and hide. They hit themselves to the point of bruising. They want to go off on their own and isolate. They crouch up in isolation. They can have a gray complexion. They can threaten violence with no remorse. They can demand that parents should do things for them if there's not internal resentment. And if not, there's resentment. And they instigate fights. They purposefully want to get other people upset and find humor or satisfaction in it. They love negative reactions and then they laugh about it. So this is kind of like a really dark bacteria energy. Let's see. Yes, very bad smelling stools, green stools, mushy, frothy stools, sensory seeking, as well as history of long antibiotic, antifungal use, or prolonged hospital stays. Here's some quotes from a mom while doing a Clostridia clear. The kicking of the door came back. He kicked a door in half. He's still doing a lot of covering. He wants his head covered. He holds his 2 temples and wants his eyes covered. While doing the Clostridia, we saw that more. More aggression, more covering, more putting items in the ceiling, throwing items over the fence into the neighbor's yard. There's 2 places in the basement ceiling where we found stuffed socks and our laundry. I couldn't find my laundry and we found a whole load up there. Then we found that he was laughing about it. When the Clostridia would go on, he'd go off on his own and would go into the basement with the lights off and push us away. He'd crouch up in a closet and cover his head and just hide. Hoodies are his favorite. Here's another quote. We suppressed Clostridia with a lot of vancomycin and Flagyl. He had high ammonia from Clostridia. His horrific gas smell came back, as well as spinning, dark circles, vocal noises, and swaying his head back and forth. Most of these signs are of Clostridia or yeast, and yesterday throat clearing and ear covering came back. We think it's Clostridia. Okay, so the ear covering, for some reason, I've seen associated with Clostridia. He stopped wearing his hooded sweatshirt after doing a Clostridia clear. Clostridia remedy helps him also go to the bathroom. Parents have also described the Clostridia smell as indescribably horrific. You have to clear the house, like a mix between garbage, barf, and gym socks. Here's a case of a boy with pandas and Asperger's and Clostridia infections. He was on 10 rounds of antibiotics before his first birthday. Sean received few fecal transplants to rid his body of Clostridia. It made a huge difference. Before and after testing of Clostridia, this alleviated severe aggressive tendencies, biting, ripping out of hair, threatening to kill and stab us. He still gets angry and yells and tells us he wishes we were dead. Case in point, last night he yelled at us because I told him it was bedtime before the fecal transplant. I would have to lock my other son in his room for his protection while Sean bit, kicked, hit, and threatened us. He used to tell us he wanted to watch us fall onto a knife and die, but he hasn't said that since the fecal transplant. He also had the worst case of baby acne you'd ever seen. He had white pimples all over the face, trunk, and diaper area, and his scalp was totally scaled and itchy. He also had reflux and GERD. He has stomach aches, green and frothy poops before the fecal transplants. We gave him constitutional anacardium, which calms him down. But if he has candy, like any artificial colors or dyes, it makes Clostridia go crazy. She says the Clostridia is like the hurricane that wipes out everything. She said there's a hurricane that wipes out everything but a little shack, and that shack will be Clostridia. It's just always there. When he has Clostridia, he has a monotone voice. So we do a Clostridia clear 30C through 10M. His stools improved with Clostridia. Whenever Clostridia is there, there's flat affect and anger, and his poop looks off. I redose it, and his socializing gets better. If he's ever off, I give Clostridia or anacardium. His handwriting is still not great, and he's still affected by artificial crap in candy. So yes. So this is an example of the extreme aggressiveness of bacteria. This is the worst of the worst in a way. Okay, mycoplasma. Mycoplasma is a little bit different. Mycoplasma does not have a cell wall. Mycoplasma isn't about boundaries. It's about the already broken down boundaries. And so it's not affected by antibiotics like penicillin. And so mycoplasma results in walking pneumonia. It's hard to treat. This kind of genus of bacteria is called parasitic, and it can, cause walking pneumonia, as well as Mycobacterium genitalium, which is involved in pelvic inflammatory disease. And so this is kind of the opposite end. Boundary is broken down. It's not responsive to antibiotics. And it's for people who don't have boundaries, who don't put walls up. and this energy can come in easily. And this is the phosphorus type of person. And it's no wonder that this comes in and affects the lungs. Phosphorus has no boundaries and their lungs are easily open to infection. Mycoplasma is super common. 2 million Americans get mycoplasma a year. It's easily spread through contact with respiratory fluids. It regularly causes epidemics. Its most common sign is just a dry cough with fatigue, just dragging fatigue and a kind of sadness. This is a great post-COVID remedy. Strep pneumo and mycoplasma can both be useful post-COVID nosodes. Mycoplasma is also super common co-infection with Lyme disease and pandas and pans. So this sometimes comes up if there's a layer of just sadness with fatigue. This is a great remedy. So mycoplasma puts up walls when they're feeling sad. So they're tired. So they go off on their own and they become kind of Natmir. It's almost like I had no walls. Now I need to go within myself. That I need to get quiet. They become distant. Their communication goes down. It's like their phosphorus connection becomes like phosphoric acid or like Natmir. They may state that they are suicidal, but it doesn't seem serious. Physically, again, history of lung infections, croupy cough, it might be mixed with other nosodes. It might be mixed with like pharyngitis, rhinitis, sinusitis types of symptoms. Here's some mycoplasma quotes. It feels like he can't take a deep breath in or feel good. There might be mycoplasma lingering. There's a sadness creeping back in. It builds every day. Morning anxiety feels like something bad is going to happen. Just more emotional. Everything is a big deal. More susceptible to getting upset. I don't want to do this. I don't want to do that. Here's a quote from mycoplasma. It seems to be associated with emotions. Sometimes it's just a tightness out of the blue to take a deep breath in. It hurts and it is tight. Then it seems to be a panic feeling. Oh no, I can't breathe in. I need to take a few deep breaths. A little panicky feeling. I don't know if it's the panic, then the tightness, or the tightness, then the panic. Seems like lingering sadness that you don't really know where it comes from. Really sad and scared. He does cry. His crying is he doesn't want to leave. He's emotional. He didn't want to get out of the car. He hasn't done that for a long time and he's stuck between the spots. Scared, sad to be separated, and tons of tightness and tension in the body. Here's a mycoplasma case. This was a sweet phosphorusy girl. Actually, at some point she needed carcinosin and anacardium as well. She's an overachiever, likes attention, wants to get the best grades. She can be a little bit saucy and sweet, pretty wiggly and tense, gets a hacking cough. The dry cough that wants to be a wet cough. Her chest feels tight. She can't take a breath. She's chilly a lot. She gets intrusive thoughts that harm will come to others. She feels heavy and extremely conflicted. She wants to be nice. I want to be left alone. I feel tight in my chest and sick to my stomach. Someone just punched me in the stomach. So I gave a single dose of mycoplasma 200C. And for the first time she had a fever, she broke out in a rash and she got better and we went back to giving her phosphorus. Okay. Meningitis. Meningitis is inflammation of the fluid and membrane surrounding your brain and spinal cord. The swelling of meningitis usually triggers symptoms such as a really severe headache. I mean, if you imagine your whole spinal cord being inflamed, be headache, fever, and a stiff neck. Sometimes it can be so inflamed that the person can't even put their legs straight. They have to kind of pull their legs up because it's almost like the spinal nerves are being pulled in tight. A bacterial cause of meningitis is Neisseria meningitidis, a bacteria of human origin that can be considered normal flora in the throat. There are other causes of meningitis like strep pneumo, listeria, Haemophilus influenza. Bacterial meningitis can be very serious and cause fatality within a few days. Oftentimes, if they're worried a baby has it, they will do a spinal tap, which in itself is quite injurious. Maybe needing high potency hypericum or a spider remedy later on. Meningitis can also be epidemic in college dormitories and military bases. Interesting, colleges and military, what's happening there? Aggressiveness, sexuality, more bacterial activity. So with meningococcinum, there can be confusion or difficulty concentrating, drowsiness, hallucinations, delirium, change of personality, prolonged depression, OCD, blackouts, stiff neck, fever, seizures, sluggish reflexes, vomiting, joint pain. And here's a case, and this is interesting because this was a case where a man was in Israel at 19 years old, doing a lot of adventuring, a lot of yang activity. They went swimming in the Nile and he caught pneumonia and meningitis. He was so ill, he had to be airlifted to a hospital in Tel Aviv, and he was close to death. They thought he wasn't going to make it. Since then, he had headaches that even morphine didn't work for. He had 25 brain surgeries. He had immense amount of pain management and terrible headaches. Sharp pains in the head, feels like a vice around the head. His head feels too small. It felt like a cyclone, typhoon going on inside the head. Tingling, squeezing, burning, oppressive, overwhelming, swamp in the head, frenzied. So I muscle tested purely on this case, and I gave him a combination of lycinum, which is rabies virus, so viral nosode, and meningococcinum, and he had a miracle cure. He said, I noticed my head is clearer, it's less foggy, it's less weighty. My head doesn't feel it weighs 50 pounds. I no longer have the feeling that my head is being squeezed. I feel different during the day. I don't have to lie down as much. It feels like my head is like you've opened the window and let the fresh air in. It feels clear and clean and not congested, no longer chaotic inside. Bacterial nosodes, actually, there's many types of nosodes that are useful for the GI. There's candida and fungal nosodes, parasite nosodes, but we're just going to talk about the bacterial ones. And we've got to love the bacteria in our guts because they serve us well. We get a lot of our digestive power and vitality from the nutrients that are released by the bacteria operating in our flora. I did a little survey in the last class and just about like what types of other things can we do to support our digestion and bacteria. And so this is what people said. They said organic, gluten-free, dairy-free diet without processed sugar or processed foods. Popular diets are grain-free or SCD diets, paleo, Weston Price diet, as well as the raw vegan diet. Some people said no diet, no limitations. You've got to feel into every day what your body needs, intuit that, because each child and family is different. And I would agree with this. So many supplements can support our GI system and bacterial flora as well, including probiotics. Although, yeah, some people weren't really big on probiotics, but there are some good ones. Megalospore probiotic and cytoflora. Probiotics sometimes can throw off the natural flora, so you really have to be sensitive to that. And there's some popular supplements, Restore, Biocidin can be kind of antimicrobial. Once in a while, that can be useful. Berberis can be antimicrobial once in a while. That can be useful to kind of help bring a little bit of bitter energy to bring it into balance. Baking soda, fermented foods, parasite herbs, aloe juice, clay, magnesium. And then there's so many GI remedies that were popular when I surveyed the group. So let's look at some nosodes. This is a nosode that I posted up recently in the group because it was a case that I had just had. And I haven't had this before, but this was a case of a girl that wanted to be a vet her whole life. And she had a trauma with a cow stepping on her foot, which ended up making her go to grad school to develop foot prosthetics. So it's interesting that this remedy was really powerful for her because it is an infection of cows. So it's called Mycobacterium paratuberculosis, maybe associated with TB, but it's its own bacterial nosode. And the mental state associated with this nosode is fear, in which one is not fully conscious of, concentrated in the bowels, which saps its vitality. It upsets the bacterial flora as a result. These people are hard workers and they use their hard work to distance themselves and control their fear in the bowels. That's a quote from Paul Theriot, ND. And the physical symptoms are IBS, the kind of anxiety that makes you run to the bathroom frequently, diarrhea, stomach pains, malabsorption, and dysbiosis. You know, it could be a remedy that could help just a little bit of dysbiosis kind of come to some normalcy. In this case, this was like a really perfect case for this remedy. It fit all of the boxes. She had incredible anxiety, worse in grad school, manifesting in her stomach. She had anticipatory anxiety with all types of things, especially when she was about to get in a car and go somewhere. She was fearful that she would have to run to the bathroom when she couldn't. She had the runs, she had IBS, and a lot of anxiety about being a freshman, being away from home, being used as a patient model in her school. And it was just a lot of fear of being out of control. And we did 2 doses of Geninum, one in 200C and then in 1M. And she said, I've been feeling a lot better. I've had some anxiety, but I don't feel it in my stomach. I have a lot of days where I don't feel my anxiety localized in the stomach at all. And it's been amazing. And she was also eating a lot better afterwards too. So that's a great Geninum case. Polybowel Plus is the most popular bowel nosode, and it's a combination of all the bowel nosodes plus healthy intestinal flora as a sarcode, plus enzymes, candida, and yeast. We carry it called Polybowel Plus. It was created by Ton Janssen. A quote of somebody who used it, she said, it's been very supportive in my overall health and raising my vital force. I use it in combination with many other clears using potencies 30C, 200C, 1M, and 10M. It helped my gut health immensely. Many foods that used to cause me GI distress no longer do, such as nightshades. I would get joint pain and inflamed gums. It helped heal my systemic yeast. Previously, having Coca-Cola would give me a yeast infection. Now that no longer happens. So, you know, personally, I would say don't drink Coca-Cola ever, but there's so many toxins that compromise the gut, and this is such a great healing for that. So right now, I would say this nosode has kind of surpassed a lot of the other ones that I would teach you. It's one that like a lot of people are reaching towards and helping them as that, like, here's a template for what healthy flora could and should be. Here's another testimonial for Polybowel Plus. So for my son, I tried every remedy I could think of for panic attack outdoors. Nothing would help. When I started Polybowel Plus, I had been researching all the bowel nosodes, taking a bowel nosode course. So I decided just to do Polybowel Plus since it had all of them in it. I muscle tested to take it daily, 30C for weeks, and then I moved up in potency and he had a big shift. We started the remedy and he started being able to go out of the house and enjoying going out. He would look at sticks and rocks and was just a huge shift that was life-changing for them. So at this point, this is kind of what a lot of people are using. But the Bach bowel nosodes are an individual group of about 10 bowel nosodes that were developed by Edward Bach, who also developed the Bach flower essences. There's tons of lecture material and information on the bowel nosodes. Intuitively, at the beginning of my practice, I thought I was going to use these a lot, but they didn't help as much as I wanted them to. And I think it's partly because we've shifted our flora so much. And we have so much toxicity in there, but there are times I have used them successfully based on my muscle testing. And so just like looking at lists, like sometimes I would muscle test an individual Bach nosode. So I don't want to like just throw the baby out with the bathwater. I want to include them in my notes here because they might come up for you. A lot of these nosodes have a really similar materia medica described as irritable, tense, anxious, depressed, prone to outbursts due to food stagnation. So it can be hard to differentiate them, which is why I like muscle testing them. I think they can be really helpful if we've had a lot of antibiotic use to kind of rebalance the gut flora. So the slides that I am going to show you come from a bowel nosode lecture online. I didn't want to just type up all of the materia medica and put them up here. So I'm just sharing them with you based on these copied slides from this lecture, which you can find online as well. We'll just review them briefly and not go into great detail. These Morgan Gärtners, there's a couple varieties of them, can be really useful for like liver, gallbladder stagnation, kind of a lycopodium type of picture, rectal prolapse, like brown discharges. This is another Morgan one, congestion of the digestive tract. Congestive headaches. This Proteus one is when there's kind of a strong changeability, but it looks like the remedy chlorum, like brainstorm, yelling, kicking, screaming, a kind of rage picture associated with Proteus. Bacillus number 7, looks like bromine, iodine, there might be kind of the biochemistry of the person is off. The minerals of that person is off, showing up as fatigue. Let's see, Gärtner Bach, or just Gärtner, is a great remedy for children where there's malnutrition, an overactive brain with undernourished body, chewing nails, sleeping for a long time, inability to digest fat. Disco looks like dysentery, like a lot of, sensitive GI where the body is kind of having diarrhea and discharges easily, very hypersensitive neurotic GI, a lot of nervous tension, ulcers from nervous tension. Psychotic Co is actually a strep remedy. So it has this kind of streppy-like picture to it, but also looks a lot like lycopodium. Mutable is a bowel nosode that mutates. And so it's associated with pulsatilla because it has this always changeability. So possibly a great remedy for like strongly changeable cases. Bacillus number 10, poor digestion of eggs, fats, greenish fish smelling, discharges, warts. And that's it. So here's a case of a 6-year-old boy who was worse with eggs, had a lot of tantrums, was mean, grabby, pinchy, a lot of social anxiety with sensory overload. He had yellow pus coming from his ears and frequent loose bowel movements. He had also had a history of antibiotics, diflucan, all of the various pharmaceuticals that upset his bowel flora. So I muscle tested him for a bunch of remedies, and actually Morgan Gärtner came up really high, followed by Torula. Torula is a yeast remedy. And so we did Morgan Gärtner and then Torula. And she said, I started the Morgan on Wednesday. It was his last day of school. He had a meltdown on the playground that morning, but then the rest of the day went well. And then since then, he's had a better than average days. He actually had great days. He saw a new kid and had a great time with him. It was one of the best, most relaxed days that we could ever remember, which is a great sign for a remedy. So then we continued him on Morgan 30C and then put him on a constitutional. You can see here my DDX were all the kind of remedies I was considering: E. coli, salmonella, various different other nosodes. And my muscle testing, these were the ratings that I had given those remedies. Enterococcinum is strep faecalis. This is kind of last week's lecture, but I wanted to include that because it's such an important bowel nosode. It's so useful for bowel rebalancing. This was a boy who had scarlet fever, and since then he had a rash on his bottom. He also had pandas. His pandas would show up a lot like rashes, and the rashes would be worse on his bottom. He also had the perianal strep. And so we gave him strep faecalis and sulfur as a constitutional. And the mom said he's no longer negative about himself. He's more accepts what he's good at. He can have positive perspective of himself, and the rash is gone. The enterococcinum or the strep faecalis really helped with that. And this is a pyrogenium case. Pyrogenium is the nosode of rotten meat pus, and it can be a really great bowel nosode as well. This was a family that all of a sudden they were visiting family, and the boy became severely fatigued. He had to crawl from one room in bed to the other room and just sleep. These episodes would continue. His symptoms were so severe. He would have barely enough energy before returning back to nap. The doctor said there wasn't anything wrong with him. The worst thing that would happen was he would get a headache in the front of his head, and his heart would beat like it's pulsating, and then his belly would hurt. It would feel like his stomach was stabbed with a spear, an ache in his belly. It could be constipation. We went to a restaurant and he became wiped out. He passed out. He had a vagal response from constipation. Like he passed out from constipation. He had aching, stabbing pains, dark circles under his eyes. She had tried giving chamomile. He had itchy skin all over. He had dreams of octopuses that were cutting him up to get away from him. He had to clean their rotting flesh. His sensation was the pain takes your breath away. You want to crawl somewhere and die. It hurts so badly. Sick like I'm gonna throw up. It feels like there's red pulsing flesh, pulsing bleeding, festering, oozing. I see pus mixed with blood, rotten round boils, blood vessels, purple, bluish, clammy. The pus, I see meat, rotting, putrid meat. So pussy, rotting, putrid meat. You want to go into a dark place to let it pass. There's a sick smell to his breath. His bowel movements are dark with putrid smells. Let's see, he gets a lot of bug bites. He had a boil that was infected, pussy, and sick. I guess I could have given him Staph aureus. It sounds like Staph aureus with the pussy quality, but I gave him pyrogenium, which is rotten meat pus, because of the sensation, and it helped him so much. The pyrogenium, he was back to who he was before. Lachesis fits him, but pyrogenium is doing wonders. It's easy. He's joking, energetic, happy. He's needed it once or twice a week. Okay, here's a case of E. coli or coli bacilinum. So sometimes we have these infections that we know we have to go to the emergency room, salmonella, E. coli. Sometimes these infections are low level and chronic. We don't really know that we have them, but we have this like dragging feeling. I had a lot of food poisoning when I lived in Indonesia. I lived in Indonesia for 3 years. And when I cleared E. coli and salmonella, this heavy dragging feeling in my gut just lifted. It was wonderful. This was a 5-year-old girl who had E. coli on her labs, and she had really terrible stools. She would strain to go to the bathroom and had pale, light-colored stools. E. coli would show up in her all the time on labs. She had loss of appetite, dehydration, diarrhea. Actually, this was also in Southeast Asia. So, Southeast Asia, Mexico, a lot of tropical places have a lot more bacterial infections. What did they call it? Montezuma's revenge. So we gave her bacilinum, coli bacilinum, and it improved her energy and her stool. So this is a summary of the GI nosodes. Not all of these are bacteria, some are yeast, but I wanted to put them all together for you. Just to kind of look at and have kind of a bird's eye view. I highlighted, some of them in terms of like what remedies they were similar to. I wonder if there's anything else we need to review here. Entamoeba histolytica is kind of like a parasite. We'll get to that one with the parasite lecture. Giardia as well as a type of parasite. And yeah, there's Chirula and Candida on here, which are going to be in the yeast lecture. And just so you know, there's polybowel nosode, which is all the Bach nosodes in combination. And then polybowel plus is the Bach nosodes plus the SAR code of healthy flora and enzymes and the Candida nosode created by Ton Janssen. So polybowel plus, it has the healthy template of flora. So let's just like think about the big picture of bacteria. Bacteria has this anger, this need to release my anger by taking it out on others, and then get angry and taking it out on myself. And the balance to that is really loving myself unconditionally, not judging myself, being peaceful, contained, connected to the earth like Buddha, very much like the meditation that I created for this week, and so we want to kind of take a breath in and out and just thank our microbial flora for all the good work that they do. Sending them love and peace and images of perfect natural balance. And honoring our own flora by honoring the flora of our environment, not being trashy, cleaning up after ourselves, nourishing the planet, and bringing our outer environment back into balance to bring our inner environment into balance. So thank you guys so much. Love yourselves, give yourself a big hug. And this concludes the Bacterial Remedies Lectures.